Medical training is certainly a very challenging time. Students are often under tremendous pressure to succeed academically, and they often don't have a lot of resources in their life financially at an age when they may be trying to establish partnerships and have other really important aspects of their life going on. It's also extremely competitive to get into medical school and to other medical training programs. And so it really tends to be a high pressure situation. But I can certainly attest to the fact that it demands a lot of a person, and certainly somebody could get overwhelmed by those demands. I don't think that modifying what can be considered a quote-unquote brutal training schedule would make a significant difference to the incidence of eating disorders among medical professionals. I actually really loved my medical training, and many people feel the same. Even though it's busy, it's often the culmination, it's the reward for a lot of studying that happened prior to the exposure to hospital and patients. However, I really do think that the type of individuals attracted to medical training have the types of personalities that may be at risk for eating disorders. I think that these people tend to be somewhat more perfectionistic, perhaps a bit more anxious, more rigid, and really have worked very, very hard through their lives succeeding because of those traits. And then when those traits come into contact with a highly demanding field in which there may not be as much empathy for what a person is going through personally, and where there's not a lot of time to recharge, an eating disorder can certainly be brought out. I can't comment for confidentiality purposes on whether any of the health professionals I've treated have been men, but I can certainly comment on the fact that eating disorders among men appear to be on the rise, and they should be very carefully considered in somebody with at-risk personality and temperament traits who's exposed to any kind of a rigorous work environment and seems to be struggling with body image and food. Some people wonder whether a patient should stop their medical training or stop their medical career because it seems to trigger their eating disorder. I'm not really here to give advice on that, but I certainly advise my patients to go slowly and keep it simple following treatment. And that's both treatment with me on the medical stabilization side, as well as treatment in eating disorder programs. Many of my patients want to jump straight back into their complex lives where they are indeed extremely successful. What I say is, keep it very, very simple and realize that this disease almost took your life, or at the very least, seriously interrupted it, and go very slowly as you re-enter whatever field you were previously in order to make sure that your recovery is rock solid. I don't have data on whether the medical professionals I've treated have a specifically higher relapse rate than my other patients. What I can say is that no matter whether a patient is finishing high school, entering college, in the workplace, out of work due to another medical condition, all of my patients feel that their lives are deeply overwhelming, and they often manage that overwhelm through their eating disorder symptoms. I'm sure that that's the same in my patients with medical backgrounds as well. The patients that I see are so ill at the Acute Center for Eating Disorders that we do have a high relapse rate, and we view this as a chronic disease that may have relapses as a part of the natural disease course.